And next up is client education, and this is the provision of information to groups or individuals about drug and alcohol abuse, as well as available resources and services. The global criteria here is firstly to present alcohol and drug abuse information to the client through either a formal or informal process, and secondly to present information about alcohol or drug services and resources. Okay, client education happens right from the beginning, and it really is provided in various ways. Right from the beginning with the one-on-one relationship formed between the client and the counselor is already informally educating the client about addiction and about the various areas that are affected, as well as about the recovery program that they're providing. It can also be done in a formal process, for example in a group setting. This is usually in an inpatient or residential kind of program where they use a didactic approach or format, and this is done with reading materials, handouts, workbooks, as well as texts and so on. It can also be done through educational videos and DVDs, or even audio or speaker shares. It can be done in a lecture format or workshops. It's also sometimes useful in a group setting to have a questions and answers group, for example, where clients can ask questions about any of the areas regarding their treatment or their program. Now, another area that we need to look at as well is educating clients on the peripheral services and resources that are available outside of treatment. So, for example, self-help groups and the availability of self-help groups and what they're about, because this can benefit both the client and the family. If you look at some of the 12-step fellowships, like they will have Alcoholics Anonymous meetings, but they will also have an Al-Anon meeting for the family members, because family members also need to be educated about the disease and also how it affects the family so that they can be more aware. You could also have a family workshop where families can also learn how to deal with the addicts while they're in recovery, and what are kind of their responsibilities and what are not their responsibilities, and being aware of enabling and things like that. So there are various ways we can educate. We also need to just ensure that as counselors we're competent in the information that we're providing, and that we are able to give specific examples of this information and how it relates to the client's particular case. Okay, so just three areas that we're going to cover in a little more detail is, first of all, how and what is provided. Then we're going to take a look at the availability of client educational materials, and then the content of educational programs. Okay, how and what is provided. How we provide the education would either be in a formal didactic class, and that's using materials or films as we discussed before. Didactic simply means informative, and formal would be done in a group context, which would be in a small, large or family group. The other way of doing it would be an informal process, which would be an individual one-on-one sitting between the counselor and client, where the counselor is providing the client with information in that way. Now, what is provided? The kinds of information we want to provide is information on drugs and alcohol, or the effects thereof, as well as addiction education. We can also educate the client on resources and services that are available to them and their families, as well as giving them information and descriptions of self-help groups. The availability of clients' educational materials has massively increased over the last decade, and this has really enabled facilities to improve upon their educational programs. Now that we have educational DVDs, documentaries, TV programs, we have public broadcasting services like BBC and PBS, we have emerging books on all kinds of topics, especially the treatment of substance abuse and recovery. We also have the internet as a resource, which provides everything from video clips covering various education and recovery related topics to downloadable PDFs, books available on providers like Amazon. We have private companies releasing evidence-based practices, companies like Hazelden and the Johnson Institute. Even the smallest of treatment centers are now able to provide the latest up-to-date information and provide a much better level of service and care. The PACE curriculum guide, which is Planning Alcoholism Counseling Education, which is for the US Department of Health and Human Services, suggests the following topics as content for educational programs. The first being current statistics on prevalence and incidence of drugs and alcohol, the physical, physiological, and social effects of drugs and alcohol, the stages and characteristics of drug and alcohol addiction, the dynamics of addiction, and lastly, alcohol and drug interactions, being multiple and cross addictions. Referral is where we identify the needs of the client that cannot be met by the counsellor or agency, and then we help the client to utilize the support systems and community resources available. Okay, the global criteria here that is outlined is, first of all, we need to identify the needs that the counsellor or agency cannot meet. Then we're going to explain the rationale for the referral to the client. Then we need to match the client's needs or problems to the appropriate resource. Then we also need to adhere to the laws and regulations and agency policies governing the procedure for protecting the client's confidentiality. And then lastly, we're going to assist the client in utilizing these support systems and community resources that are available. Okay, in order to be competent in this core function, all the counsellor really needs to do is be familiar with the available resources and services in their area. And this gets a little tricky if you're working, for example, in a treatment center where you're getting clients referred to you from all over the country, because you want to have at least then a base level of referral resources in at least every major city. And the problem really with this is that if we have a list of services and resources available in our area, we want to visit those resources. We want to introduce ourselves and get to know the professionals in our area and have a working relationship with them in networking, because we want to get to know what their personalities are like, what their beliefs or their philosophies are of work, and what we can expect from them, because you always want to ensure you match your client with the most appropriate resource available. Also, we need to bear in mind that we need to be able to display a good working knowledge of the referral process, and especially the confidentiality that is involved in it, because we can't give another professional even our client's name, let alone any information about them, without informed written consent from our client. So we need to think about that also. Now obviously referral is an extension of case management and closely related to case management, because it's integrated with our original treatment plan, but it also includes discharge planning and aftercare, because we're not only looking after our clients before and during treatment, but also after, when we start linking them with vocational services or employment referral resources or self-help groups and so on. Now we have attached a resource template list that you could use, that just gives you an idea of the kind of resources you want to have and what information and details you want to have about them. And then also listed next in your manual, we have included the SAMHSA CSAT TRP 38, and that's the Treatment Improvement Protocol 38 referral resources. And it just gives you a good idea of the kind of resources and a wide variety of resources and contacts that we want to have in our area if we ever need them.